It's 104.8 Channel 4. Sean hanging out this afternoon. We're going to cross over to the Adam Vital Hospital right now and have a chat to Professor Dr. Werner Ploetz. He is a world-renowned consultant orthopaedic surgeon and he is an expert in hip and knee replacement surgery, which is what we're talking about today. Doctor, good afternoon to you.
Good afternoon.
Now, let's start with maybe you telling us some common signs that indicate that one might need joint replacement surgery.
So the patients that need joint replacement surgery usually come to me with pain in the joint that's affected. The mobility of the joint is restricted and also the activity of the patient. The patient cannot walk longer distances because of pain, and he sometimes is also not able to put on his shoes because of restricted mobility. These symptoms are not specific for the need for joint replacement. Therefore, the patient always has to go to a medical doctor to get the right diagnosis.
And how do we determine if a joint replacement is actually the right option?
Yes, so at first, the doctor has to answer 4 questions. Question 1, is the reason for the symptoms in the knee or in the hip joint really this joint, or has it some other causes, for example, a problem in the spine? If the problem is really the joint, then there's a question, will the pain and the symptoms go away with the implantation of a prosthesis? If the answer is yes again, then there's a question, is there a reasonable alternative for the prosthesis, like, for example, conservative treatment or a little operation like an arthroscopy? And then the doctor has to decide, is it an urgent case? For example, is there increasing bone loss or an increasing instability in the knee? If it's an urgent case, the operation should be done soon. And in all other cases where there's an indication for a total joint replacement, then the patient himself has to decide whether he wants to have the operation or whether he wants to wait.
Let's talk about symptoms, Doctor. What symptoms might suggest severe joint damage or maybe arthritis that requires surgery?
The symptoms are the same that I said before. It's pain, it's restricted mobility and activity. And the doctor has to answer the 4 questions from before, and then the patient has to decide. So it's not simply the symptoms and the severity of the symptoms. If the patient has very severe pain, he will earlier decide to have the operations than if it's only little pain.
We are chatting with Dr. and Professor Werner Ploetz right now about something really important, joint replacement surgery. Don't go anywhere, Doctor. I've got a couple more questions that I want to ask you, and I want to find out if there are any non-surgical options that we can investigate if we are in this situation. So stay right there. More with the doc right after this to Channel 4. It's 104.8 Channel 4. Sean hanging out with you this afternoon, and I've got an expert on the show right now from Adam Vital Hospital, a consultant orthopaedic and trauma surgeon. He's got all the titles, Doctor and Professor Werner Ploetz. Now, Werner, we're talking about joint replacement surgery. Now, talk to me about other non-surgical treatments to try, maybe before considering going the full thing and whacking in a new hip and actually getting joint replacement surgery.
Yes, so usually if it's not an urgent case, then at first a conservative treatment is tried, and conservative treatment is physiotherapy and moderate endurance and muscle trainings. The patient can use, at least for a certain time, painkillers, the so-called non-steroidal antirheumatic drugs. And if training and the drugs do not help, then it's also possible to make an injection into the knee, for example, with hyaluronic acid. The patient should avoid high impact forces, and if he is obese, he should also lose weight. And if the conservative treatment works, then it's okay. Mm-hmm. And if it does not work, an operation makes sense.
All right, now let's talk about recovery times. Let's just go through some time. Say you've whacked a new hip in there. What is the recovery time?
Yes, so I tell you in short words what is the procedure after the operation. the day after the operation, the patient should stand up, and he's allowed usually full weight bearing. That's because the operations are done minimally invasive, usually in muscle sparing. The patient then does physiotherapy. After 6 weeks, he should be able to walk well and only with little pain. And after half a year after the operation is almost forgotten, and the patient is again allowed to do intensive sports, like, for example, skiing we do in Germany, or playing tennis or things like that. And objectively, the final result is only reached after 1 year. Then the muscle strength and mobility has usually reached very good end result.
Oh, it's a very interesting topic. It's a very important topic, and it's something that a lot of people should research so they can avoid having to go through some big surgeries like this. Thank you for your time this afternoon. We have been chatting to joint replacement surgeon, Dr. and Professor Werner Ploetz. Thank you for your time, Professor.
Thanks a lot. Thanks a lot.
My pleasure. It is 104.8 Channel 4.